so long, because what happens is when you feel like going out into the world and you aren't feeling so funny, you can have anxiety. And again, this is just rooted in some perceptions of yourself, that are all linked together. So, how you view yourself and how you view the world and how you view the world as viewing you are all cognitions that can be challenged to help you overcome some feelings that you have. And having a therapist sort of point out these perceptions and how you can view them in a different light will allow an individual to grow and overcome these negative thoughts that they have about themselves. So thank you for your attention, for humoring me with my joke and with my barking dog and with my personal anecdotes that relate to this theory.
Hey everyone, I'm Tessa. I'm going to be talking a little bit about the outcomes of cognitive therapy today. So in this section of the presentation, you will learn about when it works, when it needs a little help, and then the why behind when it doesn't work. Cognitive behavioral therapy is widely used today over other types of therapy, and overall seen as highly effective. It is easy to study scientifically and test success because it has a thoroughly designed format. I want you to point somewhere in the room right now. What if I were to tell you that you did it wrong? Of course you did. I didn't tell you where to point. Now, if I were to say, point to the left far corner of the room, where the wall meets the floor, you would get it right. CBT works so well because it is like that last example. The client and the therapist know exactly what thoughts and behaviors they are targeting to treat because they map it out together. They also discuss what getting better looks like, so they know whether the treatment is working or not. This format makes CBT very easy to study and chart if it is working. So, is CBT the answer for everything? Studies are being done that have started to show just how effective CBT is at helping with a number of mental health concerns. Let's watch this video here that will go into more depth about that.
Why should someone consider getting cognitive therapy? Why should someone
the answer
consider
is
that
getting
cognitive therapy is the most highly
the answer
researched
is that
kind of
cognitive therapy is the
psychotherapy
most
in the
highly
world,
researched
and it's been
kind
studied
of psychotherapy
all
in the
over the
world
world
by
and it's been
researchers
studied all over the world by researchers who have found that it's effective for a whole range of both of psychiatric disorders, medical problems with psychological components, and for some psychological issues. So the kind of psychiatric problems that it's been shown in study after study after study to be effective for are different variations of depression, anxiety disorders, substance abuse, eating disorders, personality disorders, even for severe mental illness, usually coupled with medication, such as cognitive therapy for schizophrenia or bipolar disorder. So those are just a few of the psychiatric problems that are addressed effectively with cognitive therapy. Then there are certain psychological issues such as procrastination, family problems, relationship problems, and so forth. Third are the medical problems that have a psychological component, such as chronic pain, fibromyalgia, HIV, depression, hypertension, irritable bowel syndrome, health anxiety, and obesity. And we come across more studies almost daily where cognitive therapy has been applied to other problems, other conditions.
Studies of cognitive behavioral therapy have shown a significant reduction in anxiety and depression symptoms for anxiety disorders, including panic disorder, post-traumatic stress disorder, general anxiety disorder, obsessive-compulsive disorder, and social anxiety disorder. Its improvement rate is at 78% compared to waitlist and control conditions, which show an improvement rate of just 22%. Methods used in CBT for anxiety, such as exposure, cognitive restructuring, and social skills training, were shown to be equally effective compared to pharmacological methods. And CBT was actually superior on follow-up, so proved to be better long-term. Clearly, cognitive behavioral therapy is an effective treatment option for anxiety. Surprisingly, most studies show that when it comes to depression, many of the major therapies used today are equally effective. To me, this proves that sometimes it helps just to talk things out with someone who will listen. CBT is just as effective as pharmacological methods as well. A diagnosis of depression is associated with higher dropout rates for cognitive behavioral therapy. So if psychologists can work on studies to find ways to decrease the dropout rate with this diagnosis, I wouldn't be surprised if we started to see this treatment method become more effective for those with depression. When it comes to ADHD, we often see behavioral therapy methods used, such as a token economy. It is likely that behavioral therapy is used more because ADHD is seen as more of a behavioral problem. Despite this, cognitive behavioral therapy has shown to be just as effective for treating ADHD as behavioral therapy. This shows that there is a cognitive component to ADHD that needs to be addressed. Cognitive behavioral therapy not only works to reduce symptoms, but also to reframe the client's thoughts around the diagnosis. People with ADHD have a unique and useful skill set, and CBT can channel that because there is access to cognitive dialogue rather than just discussion of behaviors. It is no surprise that cognitive behavioral therapy is an effective treatment for eating disorders, since symptoms of this disorder include cognitive distortions and negative self-talk, both of which CBT works on as principle in treatment. CBT also shows higher remission rates compared to other therapies, particularly for bulimia nervosa. Cognitive behavioral therapy has been shown to be an effective treatment for substance use disorders if the therapist works with the client to draw attention to the consequence of substance use, anticipate potential problems and create alternative coping strategies, identify triggers and create action plans to avoid them, and lastly, identify triggering thoughts and share methods of redirection. This method has shown to be effective in reducing substance use behavior. However, in severe cases, pharmacological interventions may be used in addition to CBT to increase the likelihood of successful treatment. CBT for couples, also known as CBCT or cognitive behavioral couples therapy, has been shown to reduce relationship distress and increase marital satisfaction. It is important to note that CBT not only impacts the couple's relationship positively, but also the individual. This is likely because cognitive behavioral therapy for couples relies on both parties being able to identify their automatic thoughts and core beliefs that are negatively impacting their relationship. And this likely also reaches into other elements of their lives. So working on restructuring these provides benefits to their marriage as well as their individual satisfaction with life. Sometimes cognitive behavioral therapy alone is not effective. For schizophrenia, CBT has been shown to reduce positive symptoms like hallucinations or delusions, and in bipolar disorder, it has been shown to be effective in preventing or delaying relapse. However, for both these disorders, CBT is more effective when supplemented with medication. This combination leads to successful treatment and management of symptoms in most cases. Overall, cognitive behavioral therapy is an effective standalone treatment for non-psychotic disorders like anxiety and depression, and is often the first route for treatment in these cases. When it comes to psychotic disorders such as bipolar disorder and schizophrenia, medication is needed in addition to cognitive behavioral therapy for treatment to be effective. So now let's switch gears a little bit and talk about another outcome for cognitive behavioral therapy, and that is dropout. What leads to people leaving the program before completion? Dropout rates are more likely when there is a diagnosis of depression. One of the symptoms of depression is lack of motivation, and people with depression often self-isolate, so this makes attending therapy harder. Dropout is also more likely when the format is less engaging. E-therapy has the highest dropout rates compared to any other form of cognitive behavioral therapy. Outpatient treatments also have a higher dropout rate compared to inpatient treatments for obvious reasons. Lastly, when there are less sessions in the design of the therapy, dropout rates are higher. As the number of sessions increase in the CBT program, dropout rates decrease. That is interesting considering cognitive behavioral therapy is designed to be short and sweet. Although the goal for cognitive behavioral therapy is to get the patient feeling better quickly, this shows that the process shouldn't be rushed and a realistic number of sessions is very important.
So this section is on the principles underpinning change. We're going to examine how the cognitive approach works and what is the exact mechanism within the process of cognitive therapy that causes the client to start moving towards psychological health. Modern cognitive behavioral therapy is based on contributions from two early theorists, Albert Ellis and Aaron Beck. Albert Ellis developed rational emotive behavioral therapy in the 50s, followed by Aaron Beck, who developed cognitive therapy in the 1960s. As Beck's cognitive therapy is more widely used today, we will be taking a closer look at the mechanism of change within his model. We'll be determining exactly what changes need to take place in order to help a person move from pathology towards a better mental health. Then we will apply his methods towards pathology of the personality. So the basic concept of cognitive therapy works on the principle that how we think about our situation or circumstances in our lives, our interpretation of that affects our emotions and our behavior. So if our thoughts are rational and well adjusted, our emotions and behaviors will be healthy and functional and appropriate, and we will experience a positive relationship with the world around us, good relationships, and so on. On the other hand, if our thoughts or our reactions to certain situations or circumstances are distorted or irrational, unhelpful beliefs, we will experience psychopathology and as a result have maladaptive behaviors, inappropriate emotions. These unhelpful beliefs and dysfunctional behaviors can really negatively impact how we interface with the world around us, which in turn causes more ingrained distorted thinking. So this diagram is actually the cognitive triad developed by Beck, and it was initially developed for depression. It was Beck proposed that if a depressed person has negative thoughts all the way around, they will exacerbate each other. So if a person has negative thoughts about themselves, they're going to have negative thoughts about the world, which in turn will create negative thoughts about the future. So the goal of cognitive therapy is to identify and change the distorted ways in which we might interpret a situation or circumstance. Cognitive distortions can negatively impact emotions and lead to emotional dysregulation, inappropriate behavioral responses, which in turn affect how we interface with the world. So this is an overview of the cognitive model. You can see the situation and circumstances, automatic thoughts, and reactions. Beck proposes that situations and circumstances don't necessarily cause our distress, but our distress is caused by our interpretation of the situation and circumstance. So we have situations, circumstances that happen throughout the day, and this leads to automatic thoughts, our interpretation of that situation, which in turn leads to reactions. We can have emotional, behavioral, and physiological reactions. If we are healthy, then our automatic thoughts make sense and our reactions are appropriate. We have appropriate emotional reactions. Our behavioral adaptations are appropriate for the situation. They make sense. And our physiological reaction makes sense given whatever circumstance we've encountered. So pathology happens when the automatic thought process or the interpretation of the situation gets distorted, which in turn leads to inappropriate reactions, inappropriate emotional responses, maladaptive behaviors, and stress responses, uncomfortable, unnecessary physiological responses to our automatic thoughts. And unfortunately, the reactions, emotional, behavioral, and physiological, can come back around and exacerbate already maladaptive, distorted thoughts. So in the beliefs column, which is where the automatic thoughts are, automatic thoughts appear to just be random thoughts that happen throughout the day based on our situation, circumstances, based on our interpretation of our situation and circumstances. Underneath those automatic thoughts are what are known as intermediate beliefs. These are rules that we've created for our life that we tend to live by, and they tend to remain consistent throughout different settings. And underneath those intermediate beliefs are our core beliefs or schemas. And these are deep-seated beliefs that we hold about ourselves that can either be positive and healthy, or they can be dysfunctional, maladaptive. And these are usually formed in early childhood. So while the cognitive model is typically used for distorted interpretations of relatively benign situations, given our current circumstances, we have all seen some unfortunate examples of maladaptive behavior and reactions due to the coronavirus pandemic. So while many people appear to be handling this appropriately and rationally, I think we've all seen on the news and in the stores some recent examples of distorted thinking and inappropriate reactions to this situation. So to illustrate the cognitive model with an example of pathology, I decided to use the coronavirus to represent the current situation or circumstance. So in an unhealthy person or a person that's struggling with distorted thinking, they might have their interpretation of this pandemic and everything going along with it might be, I can't do this because I'm not 100% prepared. As a result of this automatic thought, you might see inappropriate reactions, inappropriate emotional reactions, such as high levels of fear or anxiety, maladaptive behaviors, such as hoarding of toilet paper and other supplies that are unnecessary, as well as unnecessary spending. Physiological reactions are just high levels of stress reactions, anxiety, panic, that kind of thing. So these reactions in turn exacerbate these automatic thoughts of I can't do this, I'm not prepared. However, if you look at this distorted thinking of I can't do this, I'm not prepared, just underneath that, you have the intermediate beliefs, which if you remember from the last slide, are relatively consistent throughout settings. So a person that may have the automatic thought of, I can't do this because I'm not prepared, might have the automatic thought of, my family is going to suffer because I failed to prepare. Now, in this particular example, this person might have a very similar thought to a different circumstance, such as their work. Maybe they have a bad day at work and their intermediate thought is, oh no, I failed to do what I was supposed to at my job and my family is going to suffer. And so you're going to see those intermediate beliefs, like I said, across different settings. Deeper than that, we have the core beliefs and schemas. Again, these beliefs that were developed in early childhood, these very deep-seated beliefs. And this person might have a belief about themselves that they're a failure or they're not good enough, something very deep that is causing these automatic thoughts, that is causing these intermediate thoughts and in turn the automatic thinking that they're not even really aware of. So where in the cognitive model does the change take place? Beck's early training in psychoanalysis influenced the development of cognitive therapy, as well as his cognitive levels. Through psychoanalysis, he started noticing that people tended to have thoughts that were consistent throughout different settings, whether they were describing dreams or conscious situations that had happened. He noticed common themes amongst his clients, such as depressed people may have depressed thoughts during their dreams as well as when they're awake. And this kind of led to him questioning whether or not he believed that psychoanalysis really worked. And at this point, he started to really focus in on the thought process and wanted to discover if changing a person's thoughts, helping them change those thoughts and core beliefs, might help them experience some relief from whatever pathology they were experiencing, mainly depression in Beck's case, as he was developed cognitive therapy as a means to treat depression. So we know that in cognitive therapy, the change takes place with a person's thinking, with the automatic thoughts, intermediate beliefs, and core beliefs. But how exactly does this change happen? So when a person is experiencing pathology due to their distorted interpretation of a situation or event, a cognitive therapist will work collaboratively with them to help them notice and identify this automatic thinking that they may not even be aware of. And they may also help point out the emotions that are associated with these distorted thinking processes. And by bringing these automatic thoughts, which are kind of pre-conscious, into conscious awareness, the client can then question these thoughts and look at them from different perspectives and see if they're really valid or based in any sort of reality, as well as questioning some of those negative core beliefs that they may hold about themselves. So we know that in order to change behavior and emotion, a person has to change their automatic thinking. How do we change that automatic thinking? There are several methods in Beck's cognitive therapy that can help with this. The first is having to do with the therapeutic alliance, a term called collaborative empiricism. This is where the client and the therapist work together to almost scientifically examine the automatic thoughts and core beliefs that a person has. They might question whether or not these things are true, maybe ask for evidence and test them out to see if they're true in order to evaluate them a little bit better.